There we go.
Good evening, everyone, and welcome to our Midwife Live Talk from Midwife Karin and myself. I'm Anna, a mother of two, and the moderator of our talks, and it's so lovely to have you here with us tonight, and thank you for joining. And for anyone who is new to us, our Midwife Live Talk is an international WhatsApp community where we come together, we talk openly about pregnancy, birth, postpartum, everything around this important stage of life. So it's peer-to-peer support, but we also have these bi-monthly Zoom talks, which are an opportunity to hear different experiences, ask questions, and hopefully feel a little bit more informed and supported along the way. And tonight, we're talking about something that many women and families find themselves navigating, sometimes unexpectedly. It's induction of labor. And I'm very, very happy to welcome back Karin Siegler, who is a midwife of how many years, Karin?
30 years, yes.
30 years, including
Yes.
many years working in Germany and in Hong Kong. And today we're also joined by Varshini, who has very kindly agreed to share some of her own experience of being induced. Her induction involved several different methods, so we are very grateful to her for sharing parts of that experience with us tonight. And I want to emphasize that tonight is not a presentation followed by a formal Q&A. Think of it more like a conversation between friends and a medical expert around a dinner table. And, we will start with some questions to get the conversation going. But tonight is not meant to be me interviewing Karin for an hour. So the whole idea of Midwife Live Talk is that you get to ask an experienced midwife your question. So please switch your cameras on if you're comfortable doing so. Unmute yourself, put your hand up, jump into the conversation, or put it in the chat. Ask anything you've been wondering about. There are no silly questions. If you're wondering about it, chances are someone else is too. We do have, of course, some questions prepared in case we need them, but I'd much rather hear from all of you. Some very brief housekeeping. We are recording tonight's session because some people are not able to join us live because of different time zones. And we have approximately 1 hour, so I'll occasionally keep us moving forward so we can get as many questions as possible. Karin, perhaps we should start right at the beginning. What exactly do we mean when we say induction of labor?
Mhm. Induction means that the labor is not starting by itself. It's not a natural start. So normally labor starts with either contractions or it can start with a water break. Then we call it in labor. And in some cases, for example, if the mother is overdue, and overdue, this is now a little bit difficult term because overdue in the rest of the world is 41 weeks plus 1 day. In Hong Kong, usually the induction is already many times starts when women just reach 40 weeks. So right on the due date, they start to offer induction to you. And then we use either a mechanical variety on induction, like a balloon catheter or many different method to trigger the cervix to open up, on medical version. This can be either as oral medication or as a gel or a tablet inside your cervix. This is the medical induction, starting with contraction. And we also have the option to break the water to trigger the natural or natural contraction from your own body by some intervention like a water break. But all of this depends on the situation. I think today we sort all of them a little bit out because it sounds very crazy. You go to one doctor, he recommend you one method. You go to the public hospital, you go to the private hospital. Everyone has a different idea. And maybe we just jump to Varshini and ask her what was her reason for induction, because this is how the whole story starts. And why are women induced, by the way?
So for me, towards the end of my pregnancy at around 37 weeks, I did go to Queen Mary Hospital because I didn't feel enough kicks. So they actually took me in for monitoring and they kept me for 2 days because it was irregular and then they discharged me. But they did give me like the option to get induced that very same day if I was concerned. They were very flexible with they gave me the choice to do so. They were like either you can do it now or at 38 weeks or 39 weeks. And for me, they already had plans to induce me before because my baby was on the bigger side. So according to the charts they used, they said the baby was like 99th percentile. That's what they said. So I decided that I was gonna wait and then stick to the initial induction day, which was 39 weeks. Um, so that was the plan. I told the doctors it's okay, since things are now normal, I'll just wait and I'll come back in between if there are any issues. And then 3 days late, 3 days. So this was exactly at 37 weeks, 0 days. So I got discharged, and then 3 days later, I went to the bathroom, and then I thought I had I thought my mucus plug came off because I was like, why is the urine red? So I decided to go see an OB/GYN immediately. And then turned out it was just blood and urine. But when she did like a check, she said that my amniotic fluid levels were out of range. And she told me, you need to go to Queen Mary and get induced tonight. Like I was not expecting that at all. Um, she's like, yeah, go home, have dinner, and then go to Queen Mary. She wrote like a referral letter, like explaining what the issue is. So they call it polyhydramnio. I'm not sure, something.
Oligohydromic, yes. Mm-hmm.
Yes, so she wrote on the letter that because my amniotic fluids were out of range, too high, I had to get induced, and then also that I had blood and urine. So that night I started packing my hospital bag because I didn't expect like 3 days after I get discharged at 37 weeks and have to like go to Queen Mary. So after dinner, I just made sure like I showered, like washed my hair before going to Queen Mary because you don't know how long you're gonna stay there. So you want to make sure like you're fresh and all before going there. And then yeah, packed my hospital bags and I went in. And then they started the induction process the next day because I went in at around 11 p.m. because it took me time to like pack my bags and so on. So yeah, that's what happened.
And I think here we see that an induction is always needs a medical reason. So this is not something you just at the end of your pregnancy and you're looking forward, the baby needs to come now and I can't wait to see the baby. So we need a medical reason because this is a medical intervention. Once we start an induction, there is no way back. So this must be clear. It's not like let's try and see what's going to happen. Once we start, we need to finish it. And I think in Varshini's case, we have different reason for induction. First of all, it's overdue date. This is one reason, most common one. Second one, we have if the baby is actually too small. Many women in Hong Kong hear the word, oh, your baby is quite big. And this is the reason for induction. This actually, it's not, it's the opposite. So if the baby is too small and we can see that the baby is not growing anymore properly, I'm not talking about a baby who is constantly a little bit more on the tiny side, on the smaller side, then this develops accordingly. But if a baby is growing properly and nice and good, and suddenly the weight drops, and we say, oh, now the last week the baby didn't gain much weight, then we think about, oh, maybe the placenta is not working very well. We see some calcification inside the placenta when we do an ultrasound. Maybe the amniotic fluid, like in Varshini's case, is not enough. The amniotic fluid is produced by the placenta. So if there's not enough fluid, maybe the placenta might be affected. The Doppler ultrasound could be one reason. So the blood flow from the placenta to the baby is maybe limited. Those are reasons from baby side. Or we see, if we look at the mom side, like the mom have some high blood pressure, HELLP syndrome, or the water broke without any contraction yet, then this is a reason from mother's side. But there's always a medical reason for that.
And why is it then that, especially in Hong Kong, I don't know, I'm just aware of Hong Kong, I'm not sure about other countries, that this topic of, your baby is very big, let's think about induction. Why does it come up so often? Like, and also how accurate are these estimates of fetal weight late in pregnancy?
Mhm. The accurate is really a huge topic. Many times, if you do an ultrasound and they estimate the weight, it's this and that, and then the baby is born and the baby is 200, 300 grams, lighter than expected. This is a very, very common thing. So if you have the cursor and you measure it, you remember there's this screen and you have to put this little cross properly on the side, on the right top point. And if you're just 1 millimeter higher or lower, it's a completely different weight. So even if a doctor is measuring on the same day a second time, you get a different result. So the weight is just, an idea how much it is. And again, the higher weight is not so much a topic like the lower weight, what is dangerous because the blood flow is then not as good as normally. Secondly, the growth charts which doctor use in Hong Kong and Asia is many times the Asian style. And we know Asian people, they are a little bit tiny, they're smaller, they have a lower weight. So the babies are also, they have a different weight. So when we chubby Western people come tall and strong, then it's the baby is bigger as well, and this fits to the parents, and then it is okay. It might not be okay for a woman who is 1 meter 60 and quite tiny. This is a different topic, but we always need to see or to take care. The size is according to the parents and not what my computer tells me. And I have the Asian growth chart there, so this is a little bit an issue. And the other topic, what might be also an issue, this we go now back to epidural. As we know, the epidural rate in Hong Kong is extremely high. So if I have a woman with a little bit a heavier baby and the mother has an epidural from beginning on of the labor and there is no gravity working, like when I'm standing up and gravity is working extremely well on a heavy baby. So if I have a chubby 4 kilogram baby and the woman is standing and she can move because she doesn't have an epidural, this baby is pushing down, opening the cervix, opening the bone structure, the pelvis girdle, and really push down. If I flip the woman over on her back, then pushing forward a heavy baby is more difficult because there's no gravity helping. So the contraction needs to be very, very strong. And with an epidural, we always usually need oxytocin as a medication to keep contraction going. So this is more difficult if the baby is on the heavier side. Otherwise, if I have a tiny baby or it's a bit smaller, then if you're standing, it's the same thing like when I'm lying down, it's not so much an issue. So if you can use gravity, if you have an active woman, the size, if there's no gestational diabetic related or in pregnancy, then this is not such a huge issue, honestly. So it really needs to be really, really big. So doctors always have this, let's induce, baby has a good weight, we're at the end of the pregnancy, let's do it. Medical intervention. And many of them, they end up as well in a C-section. So I'm very happy we have the medical induction, because this is it's a lifesaver in some cases. And it's very important to make sure we have a healthy baby, we have a healthy mom. So induction is wonderful if I have a medical reason. If I just do it out of the blue for no reason, because I just reached the due date, think twice about that.
Hmm. Or what would you say to women? I know some women are so desperately over being pregnant by the end. They're like, I just wanted to be over.
I know.
But what would you say to a woman who's seriously considering an induction just because she's had enough and she wants to meet her baby, which is, I totally understand.
I know. It's really difficult. I mean, just, at the end, everything is annoying. Your husband is annoying. The situation is annoying. Everything, it's too hot outside. You can't move from the sofa to the bathroom. You can't sleep at all. It's really stressful. I know that. And that's true. But the thing is, just think about from one day to the next, because honestly, without a medical reason, many women, while you are in the induction phase, they regret the decision. Maybe I should have waited 1 or 2 days and it starts naturally instead of this. Because what you think, or what many women or couples believe is, okay, we start an induction and the baby is there about 12 hours, 24 hours later. It's not. An induction goes over days. An induction is something you calculate usually between 2 to 3 days. This is what you need to expect. Varshini, how was it in your case? It was not something like a quick fix, right?
No, not at all. I was actually at Queen Mary for I think 8 days, 8 or 9 days.
Yeah.
Um, because I had like the induction process took 4 days, I think, and then after a C-section,
Mm.
I had to stay 4 days. So yeah, I think I was there for 8 days. Yeah, it was a very long process. Um, yeah, I had to go through different induction methods at Queen Mary. So, they just kept trying different methods until they saw some kind of result because I think everyone's bodies respond differently to the each method. I think Robin
Mm-hmm.
has a question.
Yeah, Robin, if you have a question, please unmute yourself.
Yes, thank you. It's just regarding this point. So like regarding induction, sort of, I guess taking 3 days or even longer and potentially leading up to C-sections as well. At what point would you consider an induction to have failed then? And then what happens then? Because I hadn't realized it could take that long.
Yes, it
Yeah.
can take that long. So a failed induction is actually, first of all, we have different methods. And I think we should also look into the different methods of induction because they are really, really depends on the situation, many different methods. The risk on induction is in first, if we do a medical induction, like with prostaglandin or mimprostine, that we have an overstimulation of the uterus. Think about it. If we do an induction, we convince the uterus, you start labor now. And I need to use medicine for that. And the medicine needs to be either it is like a gel which is placed in your vagina to soften the cervix first. So in many times if it's your first baby, then we start to soften the cervix to make it ready, to make it ripe. So if it's up to the vaginal examination, and then the doctor decides what is best for you. So first it needs to get softer, and this is done by prostaglandin, mimprostine. There are two different types of prostaglandin. One is usually a small, it's like a suppositorium, it's like a tampon. And there's the gel there. It's, for example, it's called Propas. It's a quite expensive medicine, so it's not available everywhere. And the benefit here is that once it is in place and it starts with contraction, and when we do induction with hormones, we have a risk of overstimulation the uterus. So it can be that the uterus is reacting too strong to it, and you have contraction like every 2 minutes. It's always stimulated. And then if it is done, if the gel is administered with a tampon, it's easy. I can pull it out to regulate the doses. If it is in many countries done via a vaginal tablet or just a gel I insert into the cervix, then I cannot remove that. So then it is in place. And then, if we have an overstimulation, the cervix is not going to open, and it also stresses out the baby. And then we have the risk of on a C-section. So this is a topic. So this is why if we do induction, there need to be a reason, a medical reason for it. And then it is fine. I would not go for, okay, it sounds stressful, medical induction, so maybe I go straight to a C-section, because a C-section also has many negative sides and has many challenges for women and for babies. So the idea trying an induction first is an amazing idea if we have a reason. If not, it's not a good idea. About this hyperstimulation of the uterus, we see that in 5% of the cases. So you have a little bit an idea. So this is one risk, so that the uterus is working too hard and we cannot stop it. So we need to do a C-section. On the other risk, which happens actually more frequently, is that the uterus is not responding at all. The uterus is not ready yet. Whatever you do, doctor, midwife, do it. But I don't want yet because I want to give birth a week later and not now. And this we see if we do induction without a medical reason. If you have a medical reason, let's say you have a high blood pressure, there's something wrong, usually the body responds because your body is so smart. It knows there's something not perfect. It's a good idea. Let's jump on induction. Let's get this baby out in a healthy way. If there's actually no reason and the baby is okay, the pregnancy is okay, the woman is okay, then many times you start with the induction, break the membranes, you put the gel in it, other way around, you put an oxytocin drip on it, but the cervix open up maybe to 4 centimeters, 5 or 6, and then it comes to a hold, and then it's not doing anything anymore. And we can go on for another day or two, but then because the membrane has broken, the way from outside through the vagina to a baby is open, so bacteria can come up, and women after many days on induction can have fever. And if the women have fever, the mother have fever, the baby usually also have an infection. So then we need antibiotic and so on. So always again, back, medical reason, intervention, induction, great. Just because I can't wait to see the baby, it creates many times problems.
I think we just had someone else raise their hand. Was it Asma?
Yeah, it was me. Yes, it was me. Hi. So my question is, I'm at 34 weeks right now, and I have GD. So my doctor told me that earlier when I met her, she told me that I may have to get induced because I have GD. So it was because my first baby, so she was just educating me on how if towards the end the baby starts growing a lot more, then we'll have to get you induced. So when I met her this time, this was after my diabetes test, and it came out better than we expected. So she said, yeah, that looks like normal growth, so we wouldn't have to get you induced. But my question here is, do you have a gauge on when, like at which week will we have a better understanding? Only because my husband has to travel down for the delivery. So I'm just trying to like prep in mentally that this is when I will have an answer.
Mm-hmm. Gestational diabetes is one reason for induction. That's correct what you're saying. But we are not focusing just on the diagnosis gestational diabetes. The induction is based on baby's weight and how well your blood sugar is established. So if you are able to control your blood sugar level quite stable without big up and downs and jumping, so you managed it with your diet, or I don't know if you use insulin or what's going on in your body, so then this would be okay. If you jump, then an induction is okay. Or if your baby's weight is really extraordinary, growing a lot. And in gestation diabetes, we also see a polyhydramnion. So the opposite what Varshini had. Usually because of the sugar, the babies pee so much, especially if the sugar levels are high, that the volume and the amniotic fluid is on the higher side. So amniotic fluid on the higher side, baby's weight is jumping up because the baby gets too much sugar from you because your blood sugar level are not controlled and your own blood sugar level are up and down. Then we induce. If the gestational diabetes is perfect, baby size is perfect, the amniotic fluid is on the normal side, there's no reason to induce just because you have a gestational diabetes.
Okay, understood.
Mm-hmm.
Karin, maybe if we go back to the different methods of induction, is it correct? There is prostaglandins, and this could be a gel or a tampon, you said. Then there is a balloon catheter.
Mm-hmm.
Then there's breaking the waters. And then there's the oxytocin or syntocin on drip. Are these the ones? Did I get them right?
Yes,
or is there more?
But my favorite one you forgot. My favorite
I know.
one.
Is it the stretch and sweep? Yes, but I'm not sure. Would you consider that a form of induction?
No, we call it in the old days, we call it is the midwife induction. So if a mom was overdue, then we actually did a cervix sweep. And cervix sweep is not an official induction because it's not, the point of no return. You can do that, and you can do it at home. You doesn't need to be at hospital. It can be done by your midwife or by your obstetrician. And it's like a vaginal assessment in case the cervix is 1 centimeter open, so that I can stick my fingers inside gently. Then this is what is be done. And then we massage and stretch the cervix gentle. And we try to reach the membrane. So if you think about the baby is sitting in the nice water balloon in the inside the membranes with the water, and the membranes, they are attached very close and very straight to the cervix. And what we do, we go inside and we loosen this membrane so that actually the water balloon is actually more flexible and moving easier. And when we do that carefully loosen up the membranes from, we separate the membranes from the cervix, then this triggers prostaglandin. And let's say you actually about due date, or maybe 3-4 days over your due date, this triggers a lot, and it has no side effect. It's a little bit uncomfortable. I request to do it in a calm way. So usually when I do it, I tell women, you are in control. You tell me when I can move my fingers. I do it very slowly, because if you do it quickly, it's like, imagine stretching a muscle, you do a split, and then this can be uncomfortable. So request to do it slowly. If it's uncomfortable, tell your doctor to stop, give you a little bit of break, continue. And then it is absolutely okay to do that. The only thing is, afterwards, 2-3 hours later, you might see a little bit bloody show. And this is the side effects, because the cervix has plenty of small blood vessels. And if I stretch them and do something there, then you can have this spotting. And don't freak out at how this is normal. It's something with mucus. This is the first step before we start induction. You can do this when you're around 39 weeks. You can repeat it about 2 days later. And the prostaglandin, which is released through this sweep, it's there for the next 24 hours. So it's not just, okay, if it's not working after 2 hours, then it's not working. It's not. It continues for 24 hours. We see that the cervix is producing prostaglandin, and this might be in many cases enough for starting labor. I like it a lot, and I have good experience, especially if it's the second baby. Also with the first, you can try, you can't do anything wrong. Then let's go through the different methods. Then the next thing, if you are, let's call it, properly induced, and you have to go to hospital with your paper, and you are admitted to hospital, then the doctor will first examine your cervix. And he will say Bishop's score. So this means, how long is your cervix? This is not so good. So as long as it is, it's not ripe. If your cervix is moving forward already towards your vagina, or if it's still posterior, so towards your back spinal, how soft is the texture? If it's stretchy, or is it still like a very hard muscle? So we have many topics. We get an idea, where is it, where's the head, how high, how low is everything. And accordingly to this assessment, then we recommend something. Let's say it's the first baby and everything is not mature, then definitely we start to ripen the cervix with the prostaglandin you mentioned. And the prostaglandin, they are good and they're important. They make it softer. Sometimes you see belly pain, so they make you cramps on your lower abdomen. This is possible, and this can be sometimes annoying. And this prostaglandin can be repeated. So it's either a local thing you add inside the vagina, depends what the doctor wants or what is the hospital routine. It can also be an oral medication, like a tablet you swallow. Different method, but more or less everything is the same thing. The first goal is to soften the cervix. Once the cervix is, maybe, I don't know how many times you have to do it. Sometimes you do it just once and the cervix is ready. But many times, if it's your first baby, you have to repeat it after 1 day again or after 2 days again. That's possible. Like Varshini said, she was there, I think 7 days or 8 days. So it takes a while because everybody responds very differently. So once the cervix is then soft and open, then the second step starts, that the membrane will be ruptured with an artificial membrane rupture, AMR. So this is nothing painful. This is just with a hook. The membrane doesn't have any nerves like hair have. So this sounds difficult, but it's not. And then you get a drip, an IV drip, with oxytocin, and the synthetic version of oxytocin, it's called syntocinon, and this is gradually increased, so the uterus starts to contract and the water is out, so the baby can slowly move downwards. Many women, they request an epidural at this stage because the natural happy hormones, the endorphins, the natural own painkillers are missing in an induction when the women are in induction. So many of them, they request a pain method, and then we need to see how fast or slow you respond. So I don't know, Varshini, is this a little bit your experience, or was it the same thing you did? You had a balloon catheter, right? This is also
Yeah, I was going to ask, where does the balloon catheter
yes,
come in there?
I need to
Yeah.
let's say the balloon catheter is actually something new, and it is a nice thing, but it's not offered from all hospitals. So this is a mechanical method. You can either use a normal urine bladder catheter, or they have some special one with one balloon or two balloons. They insert it into the cervix. So even if the cervix is not as open, it is easy to add this small silicone catheter inside the cervix, and then they blow up the balloon with some saline water, and this stretches the cervix. And if it is a catheter with two balloons, this is also available. Then one is between the membranes, remember, in the head of the baby, and just on top of the cervix, the internal os of the cervix, to stretch there too. This gives a little bit of pressure, so women feel a pressure down there. And also we see, again, like with the sweep, some spotting, some bloody show. This is normal, but nothing to worry about that. And it's more gentle to do that. It's more gentle for the start into labor, because it's a non-medical induction. It's run mechanically. You can remove it right away. We do not see overstimulation of the uterus, and yes, so this is something what is positive. Also, these days we see in Europe, it's like a small tampon, and you add it inside the cervix, and it soaks up the body fluid. And why it soaks up body fluid, it starts to extend and to grow, and slowly it stretches the cervix slower and in a very slow way, and this creates prostaglandin, the one like the gel we add. So all the balloon methods are way more gentle. And I would, if you talk about intensity and what is the, start with a sweep, then the balloon catheter would be the next. And then more severe is then the minprostine or the prostaglandin as a gel or as a tablet, and then the membrane rupture, and then the oxytocin. But so this is if we go, yeah.
And is this the standard sequence that everyone goes through, or is induction much more individualized than that?
It's very individual. It's very individual. If I have a woman and she is expecting her second baby, normally the cervix might be soft already. Cervix can be 2 to 3 centimeters open. She doesn't need any ripening of the cervix. You can break the water and wait another 4 or 5 hours just about the artificial membrane rupture. Many times that's enough. If it's a second baby, they just walk around and a contraction starts naturally. Or you do a membrane rupture, artificial rupture of membrane, together with a syntocinon drip. This might be enough. We do not need this softening of the cervix, which takes a while, days before we can start with that. So it depends. It's very, very individual. You cannot compare it. Yes. Varshini, this was what you did, or how was your experience?
Yeah, so the first 2 days I had the prostaglandin pessary, the first day. The second day I had the prostin gel. And then that's when like I started having some contractions, but very mild. And then the third day I had the balloon. So when I compared the three, the balloon was like very uncomfortable, like painful, uncomfortable when they were inserting it, which was not the case with prostaglandin, and with the balloon there was, bloody show. I don't know if it's normal, but at Queen Mary the balloon is always inserted at night, um, which was not the case with the prostaglandin and prostate gels. But one thing that I liked about Queen Mary is because it's a public hospital, there are other women going through what you're going through, like at the same time. So you meet other women who are also getting their balloons
Yes.
that day. And, it's like when you feel like the pain is halved because you're sharing the pain with someone else. But so yeah, the balloon was inserted at night, and then right
Mhm.
after they insert the balloon, they monitor the baby's heart rate for 2 hours. So
Mhm.
that part was quite exhausting because you need to be in a position where they can, like, because depending on the baby's position, like you need to like stay like static in like a position where they can hear for 2 hours. And at one point, like they couldn't, like, I don't know, it was like irregular, so they made me stay an extra 2 hours for monitoring. So it was like 4 hours. So I could not sleep at all. I think it was 2 hours yeah, it was 4 hours total. And yeah, well, my friend that I met in the pre-labor ward, she was done after 2 hours. So it did, just keep in mind that, things like this can happen. But when they insert the balloon, no matter what happens, you're going to the labor ward the next morning. So when you're planned for the balloon, they'll give you the purple outfit because in pre-labor ward, you have the pink one, and then in the labor ward, the purple one. So they'll give you the purple one to change into the next morning. So just make sure you have, like, if you know you're getting the balloon, just make sure you have like a nice meal prepared for next morning. Like I don't know, get your partner to bring or whatever it is, because after like a certain time they're not going to allow you to eat, because they're like, oh, in case it ends up in a C-section and so on. They're very like strict about what you can and can't, like, if you're induced through the balloon. So just make sure you have a nice meal prepared, because they just give you congee and a boiled egg at Queen Mary. um yeah, then so obviously I was not alone with the balloon, and for my friend it didn't happen, but for me the balloon actually came out around 4 a.m. But it didn't come out for my friend. So I think it depends, like, on how dilated you get, because if you dilate a bit more, is that true, Karen, that the balloon falls off?
Yes, it falls out. And this is why
Yeah.
we don't want you to walk around, because then you lose the balloon when you're walking too much. But there's one thing what might be a little bit Mary style, because this is not what we do in other hospital. The balloon doesn't need any monitoring of the baby, the CTG, because
Okay.
actually the balloon doesn't have any side effects on the baby at all. It creates minprostine, or this is what it should do. But this is in such a mild way that it doesn't have any side effects. So usually that they made you in a position, I'm sorry for that, but this is actually not with a balloon necessary, because the baby is
Okay.
not affected. This is just an induction in your body. While the medication, the minprostane, the oxytocin later on, or the prostaglandin, which we insert, yes, then you need to stay on the monitoring, because everything what creates strong uterine contractions, though, on the top, not on the lower cervix, this has a side effect on the baby, because during contraction, and this is a very normal thing, the blood flow to your baby is a little bit reduced. So if the contractions are regularly and we see contraction and the pause and contraction, then the baby always gets enough rest. But the risk on the medical induction with prostaglandins can 5%, this is the number we know, can be overstimulation on the uterine contraction. And then the baby's heartbeat could be affected. And to make sure this is not going to happen, this is why we need the monitoring in the CTG. So this is the first step. So the balloon catheter is there, it's way more gentle, even if it doesn't feel like this because you have the cramps, what I understand, but towards the baby it is way more gentle than prostaglandin. And also this is also maybe a little bit Queen Mary thing. If you're induced, you still can have small snacks and small drinks, even if you can have a C-section. So in other hospitals, this is handled a little bit in a different way. We don't want to see women eating, I don't know, a pork leg or whatever, but a small sip or small drinking. We needed to stay on energy and feeling okay.
Maybe coming back to the topic of pain management. When you have an induction, do you have access to the exact same pain relief options as you do during a spontaneous labor?
Yes, definitely. Definitely, you have the same pain method. Let's say in Hong Kong, most likely it's an epidural. So definitely this is available as well in the public hospital as in the private hospital. That's not an issue. See how it goes. If you're in the private hospital, you can get the epidural right away. In the public hospital, you have some waiting time. Sometimes depends how busy the anesthesiologist is. So it would be good if you request it early, so because you need to wait sometimes. In the public system, it is worth at least using the gravity a little bit, because the issue of induction is we want the labor to start, and you can support this amazingly by just being in an upright position, standing. Even if you're trapped to the monitoring and you cannot move freely, or you have an IV drip, at least you can stand and move and do something what is with an epidural a little bit difficult, or they don't allow you to do that. So if the induction is not as strong and the medication, you can still tolerate it, just use the time in being on your legs. So this is possible. You can use the Antonox, the laughing gas. That's fine. You can also use that. And Pethidine these days, the injection in your thigh, this is usually not recommended so strongly anymore, so we don't see that. You can use all your natural pain relief, like the TENS machine, that's fine. And using, relaxation techniques, that's absolutely positive. One more topic, what is important and what is on my list is an induction with medication like prostaglandin or oxytocin is not recommended if you had a C-section. So if you're going for a VBAC, vaginal birth after C-section, then it is possible to maybe do an artificial rupture of membrane to bring things forward. It is possible to do a cervix sweep, and it's possible to do the balloon catheter. But otherwise, in many, many countries, or in most countries, there's no recommendation. So officially, you shouldn't use the mimprostine or prostaglandin as an induction if you had previously a C-section.
Yeah. Okay. Thank you. That was actually going to be one of my questions. Yeah, because I had a VBAC. Varshini, you wanted to say?
Yeah, I just want to add on. So during the induction process, so when I had the balloon catheter, Queen Mary, like the midwives, the staffs there were really kind. They offered like a TENS machine to deal with the pain.
Nice.
You have to ask for it. They were like, "Oh, do you want one?" Because before going to Queen Mary, I thought I had to rent it out from like a place, but they have everything available. They even asked me if I want like aromatherapy in the labor room. I didn't opt for that because for me, I don't think it
Nice.
works. But yeah, they're very like flexible. And the TENS machine is readily available. And in the labor room, there's like a continuous supply of what's it, gas? Like what was
Antonox, laughing gas.
yes, Equinox, yeah. So that one was also very, very helpful during induction.
And I think one important question, Varshini, many women would love to know, when was your husband allowed to be with you? Because we know the public system, especially when we talk about Hong Kong, is a little bit difficult with the partner, birth support partner. So when was he allowed to join you?
Do you mean in the labor room or just in
Yeah, or
general?
before? I don't know. What about when you had mimprostine or the balloon catheter? Was he
Okay.
allowed to be with you or no?
Okay, so he was not allowed with the balloon catheter, but there was like 2 hours in the daytime. I think it was 12 to 2, and so noon to 2
Visiting.
p.m. and 6 to 8 p.m. visiting hours, during which he'd come and visit, bring me food and so on. But outside of those visiting hours, I was still able to meet him like outside of the pre-labor ward. So there's like seating, there's a bathroom, so we'd have like lunch together. We'd walk around the hospital. Like the nurses were like, yeah, it's okay. Just keep your phone on because we'll call you back for monitoring. So you are allowed to like go around, walk around in the hospital and so on. and then come back when they call you. So, you just need to be in like the pre-labor ward for monitoring. Other than that, they're quite flexible. It's just that the visitors will not be allowed inside. For the visitors, they do expect them to wear face masks. This is not the case for the women in the pre-labor ward, but any visitors coming, they will ask them to wear face masks. So just make sure they have them on hand. And then the day after after the balloon catheter, the morning after, because I had my purple outfit and I was ready to go to the labor ward, we decided that my husband was going to come to the hospital like early morning. But unexpectedly, what happened was because they had planned, I think we were like 4 women like scheduled to go to the labor ward that morning. But then suddenly there was like an influx of new admissions, like, oh, a woman's water broke. There were too many women, and suddenly they had like way more women to look after. So they had to like prioritize, like, oh, not everyone's gonna go. We're gonna prioritize based on risk levels. So we didn't know how long I had to wait. So I just texted my husband because it was gonna take him 20 minutes, like, okay, like I'll let you know once they call me. And then I was quite early on because of the referral letter from an OB/GYN in private. So they like classified me as high risk, but then my friend who was supposed to go in, she ended up going at 2 p.m. So she had to wait much longer. And then so once I went to the labor room, they broke the waters manually. Wait outside the room when they were breaking the water, and then once that was done, he was allowed to enter. And then every 4 hours, like the doctor came in to check the cervix, but otherwise you're just alone with your partner in the room. You can have your phone, video call your family. You can, yeah, like, yeah. So, they were very supportive, the staffs at Queen Mary.
That's good to hear. Karin, actually, I have another question for you. I always think about how can you best prepare, especially if you're not a medical professional, and this can feel quite confusing, overwhelming. So, what questions should a woman ask if she's being offered an induction, or or if she does enter the process of induction, is being presented with her options?
Yes. So it depends what is the situation. If there is no medical issue, so the mother is healthy, the baby's weight is okay, amniotic fluid is okay, and she's just overdue. And then in Hong Kong, you are offered an induction method, or you get an appointment usually around your due date already. So 39 weeks, 40 weeks, they tell you, okay, if the baby's not born in 5 days, please show up at the hospital. And the best way to approach these is to ask if it's possible to put the induction 3 days later. Ask what is the Doppler ultrasound doing. So if the Doppler ultrasound is actually okay and the blood flow is fine, everything is okay, it's beautiful. Ask for the amniotic fluid. If it's still in the normal range, it is absolutely fine. So don't worry so much. So ask specifically what is the reason for induction? Why, as from the doctor's perspective, maybe he sees something you don't know or he's not telling you. Why does he recommend an induction? And what would happen if you wait 2 or 3 days later? So the best thing is not just saying, no, I don't want an induction. Again, inductions are very, very important. I'm happy we have them. But find out is there is a medical reason, or is it just the standard protocol he's pushing you through. And about this weight thing, if they tell you the baby's weight is high, this would not be a reason for me. So this is something depends, if there is a gestational diabetes there, and this is why the baby is too big, then definitely. But if, I have a proper size from parents, they are tall and a little bit stronger, and they also have a higher birth weight, then go with the flow. And again, the weight is not so accurate with an ultrasound. Many times it is a different birth weight at the end. And if you use gravity, it's the opposite. The baby's weight can make so much space. And they're usually fast births if a woman stand because it puts more pressure on your pelvic floor and opening the cervix faster, and this is a benefit. So ask questions about what is the medical diagnosis, why is it important, what happens if I wait 3 more days or 4 more days, and if you don't feel pushed, even if you agree for an induction day and you feel, I don't know, one day early, this is wrong and the baby is okay and all the measurements are okay, feel free to say, I would like to postpone it to 2 days or to 3 days. This is fine to do. Because again, once you start the process, you can't stop it. Then you will stay at hospital until the baby is born. And this can take some days. And I don't know from our talk now if induction is has a bad image now. I don't hope so, because again, induction is important. Just the reason need to be okay. And it's not like going, okay, if I hear everything about induction, maybe it's better I do a C-section. This is not what I'm saying. We have, or I know many very successful induction. They work quickly and good. And many times, if there's a medical reason, your body is so smart. It knows this baby should come out now. It's supportive, it's helping. This is a good thing. Just because of I reached the due date, I'm tired, I would consider it and go maybe give it another 2 or 3 days. So I think this is what I would recommend. Yes.
We have one more question. Hi, my due date is this Saturday. Oh, exciting. And
Nice.
today I had my appointment with a midwife, and she said they will have to induce if my baby is not born within 10 days after the due date. Does it make sense to try to negotiate that, or 10 days is already late and I should just follow their lead?
Mm, I think 10 days, this is okay. Starting induction by 10 days is actually what is also in Europe a normal thing to do. So this, I think it's okay, because you always need to calculate the extra days on top. If you induce on day 10, this doesn't mean the baby is born on day 10. It can't be possible born on day 14. So we need to need to have a few days, where we can plan the induction. So starting induction by day 10 sounds to me reasonable. There are also some countries in Germany, for example, you can wait with induction until day 14, so due day plus 14 days. That's possible. In Hong Kong, they usually induce by plus 7 days, and you can negotiate it to day 10. In Germany, you can go to day 14. But honestly, to me, if it would be my pregnancy, I would be okay with inducing on day 10. That's yes, because you have some extra days. And don't forget, your placenta is not as fresh and not as good on day 14, like it, for example, is on day 10. So yeah, this is why I would be okay. That's fine. It's good to go with day 10.
Yeah. Yeah. Again, an induction is not a bad thing. It
No,
sometimes maybe it's a bit of a bad rep, but it is when it's indicated, medically indicated, then it's a godsend. Yeah. I have also one thing to share that has helped me a lot, and I still do this when I have pediatrician appointments with my kids. It's this anagram that helps me just to understand the situation better, because I'm not a medical professional, and sometimes, the doctor says something, I don't quite really understand it, and I want to understand my options better. And then I use the brain anagram, and it has worked really well for me. Basically, you go through, I think the first question that Karin said, like, why do you suggest an induction, is very important. But this anagram, I'm just talking from my own experience, has helped me a lot throughout the years. It's what are the benefits, the risks, what are the alternatives, what does my intuition say, and then what happens if I do nothing? Because doing nothing can also have implications, good and carry risks too. So yeah,
that's a good
so
idea. Yes.
it's just to gauge, to understand the situation better. And I just wanted to share it here again. Some of you might know it already from the WhatsApp
This
group
is
or
very
something.
nice. But
Yeah.
now, Varshini, we need to know the end of your story. What happened with you then after the induction? You mentioned already something like C-section.
Yeah. So basically in the labor ward, after they broke the waters, they were waiting 1 hour to see if the contractions were starting, and if it didn't, then they were gonna give me the syntocinon drip. So, they gave me they were injecting the synthetic oxytocin to start the contraction. So I did start feeling them. And then they were like kind of changing the dose, like, oh, like there's no progress, let me increase the dose. And the baby's heart rate was unstable, then they reduced the dose again. And then at around 6 p.m., I got an epidural. And then after I got an epidural, they increased the dosage again. And when they increased, I think the contractions were too strong that the baby's heart rate was like dropping. And then that's when they decided I needed an emergency C-section. Um, they were extremely fast. Like I was just like laying in the room, and then suddenly it feels surreal because suddenly 25 people rushed into the room. Like, and then so like there's like doctor showing me like the iPad, like asking me to sign like a consent form, like for a C-section and so on. And they just rushed me through the room. They were like exceptionally fast. The surgery was like really fast too. My partner was allowed to be in the room. Obviously, in the surgical room, your operation theater, you're not allowed to have your phones. So they just asked him to like leave his phone and take my phone and leave it outside and then come in. And then they have like a cardboard in front. So the partner is like sitting like where my head like next to me, but he can't see what's going on because they have like a cardboard blocking there's like when they're doing the surgery. So yeah, so that's how it ended up in a C-section.
Yes. Yeah. So it was actually overstimulating. This was this 5% risk on overstimulation of
Yeah.
the uterus contraction, which can affect in some cases the baby. Yeah, that's fine. So it's good we have the C-section. We have all the medical option available, and so your baby is healthy and happy, and everything went at the end well. But you had a long stay at the hospital, right?
Yeah, so yeah, definitely, because I think we have to stay there for 4 nights after the C-section. But the team at Primary, they were so supportive.
Sweet.
Immediately after the C-section, I was low on oxygen, so they actually gave the baby to my husband, and I was alone in the room. Uh, so the baby was with my husband, but he got to spend like I think it was like 2 hours with the baby while I was, taken to a room to give my extra oxygen. And then they brought me to the post-labor ward. And then my husband could stay there for an hour. It's outside of visiting hours, but they're very like flexible when it's like right after giving birth. So yeah.
Lovely.
Oh, very nice. Thank you for sharing that with us, Varshini. We have 2 minutes left. If there's anyone
Yes.
with a question, now is the time.
Otherwise, we always have the option to ask questions on our chat group, WhatsApp chat group. So that's fine. Lovely.
Oh, I do have one thing to mention because
Yes.
I think it was so after the induction, sorry, after they decided that I was gonna get like and I think it was when I got the epidural, they asked me if I wanted spinal epidural or spinal anesthesia or general anesthesia for the C-section. So they do ask you for like your choice. So I think it's best like to do some research to see what fits you best. Because when you're asked that at the labor ward, like you don't have time to think, like you're stressed and so just something to keep in mind.
And this, I just need to add, this is a Hong Kong thing. You don't have this in other countries. The general anesthesia is usually not offered for a C-section. So usually it's either spinal anesthesia or if you have an epidural from before, you top them up. Depends how quickly this must be. So yes, sometimes still a Queen Mary offer that, but this is not the normal case in private hospital or also in other countries. Depends where people are watching our Zoom talk. But yes.
Someone's asking, how do you join the WhatsApp group? Okay, let me quickly get the link.
Lovely. No, we were
I'll
at the
get it
link.
ready
That's
for you.
fine.
Before you leave, I'm gonna try and find it. So, Karin,
That's
find
fine.
something else to talk about.
But I think no. There's no need to talk about it. I think let's say at the end, no need to be afraid of induction. Definitely not. That's the most important thing. Ask clear question, and if you do not feel right about the decision and there's no medical reason, don't feel bad to call the whole story off and say, I come in 2 days or in 3 days again. So don't feel pressure because many doctors they start offering an induction quite early from 9 weeks. And this is something it's not good. I think the reason why induction has such a bad image is because it is offered so frequently. If I think about induction in Hong Kong, there was about 60% of all vaginal births are induced, 60%. They all do not have a medical reason. This is crazy. And then definitely as more I do medical intervention, as more things happen. This is what we need to be aware of. If we use it just selectively on medical reason, we would not have this negative image of an induction as something bad. So be aware of that. It is not bad. It's not good. It's just important we have it. And I think this is my important outcome from this talk.
Okay, thank you so much, Karin, for helping us understand the clinical side of induction. And thank you especially to Varshini for sharing your experience so openly.
Yes.
And thank you to everyone who joined us, and importantly for actually asking the questions. That's what these talks are for. I hope everyone leaves feeling a little bit more informed and perhaps most importantly, a little more confident about asking questions and being part of the decision around their own care. So follow us on Instagram, join the WhatsApp group, and
Spotify, YouTube.
And Spotify and YouTube. My goodness.
Yes.
And thank you, everyone, and good night.
Bye-bye. See you.